Hi, everyone. I want to extend a heartfelt welcome to each of you joining us for our event in the launch of Flavors of Tamil Health, Creating a Diabetes Cookbook. This event is hosted by the Tamil Association of Residents and Medical Students at the University of Toronto in partnership with the South Asian Health Research Hub at McGill University. This event will explore the powerful role of applied, co-led research in driving meaningful community health outcomes rooted in allyship and solidarity of all of us who self-identify as being part of the South Asian diaspora. My name is Ananya Tina Banerjee, a second generation racialized settler and child of immigrant parents who came to Canada in the early 70s from Kolkata, West Bengal, India, impacted by British colonialism. I'm at present at McGill University as assistant professor and serve as the Equity, Diversity, Inclusion, and Anti-Racism lead at the School of Population and Global Health. I'm also the co-founder of the South Asian Health Research Hub. I'm about to share a land acknowledgement as an invitation to inquiry and to reflect how we can deepen our relationship with the land acknowledgement. Majority of us join you from Toronto, covered by Treaty 13. This territory is the subject of the Dish with One Spoon Wampum Belt Covenant, a treaty between the Anishinaabe, Mississaugas, and the Haudenosaunees that bound them to share the territory and protect the land. For us to say this, it is a continuous wake-up call for all of us where and how we can learn more about colonial oppression, the disposition of land, the residential school system, the 60 scoop, and other destructive government policies in Canada. We must walk forward together with the permission of Indigenous communities towards a future where Indigenous human rights, including the right to self-determination, languages, cultures, and traditions and laws, are recognized, valued, respected, and celebrated and honored. We would also like to acknowledge those who immigrated from South Asia to Turtle Island, this land we call Canada today. We would like to acknowledge all of our ancestors who left their homes or were forced to leave due to social political unrest. The South Asian diaspora is vast, intersectional, and diverse, and we must recognize this diversity and acknowledge the differences in lived experiences due to migration histories and other intersecting axes of power and privilege. I'm now proud to introduce the team behind Flavors of Tamil Health, Creating a Diabetes Cookbook, a meaningful community outcome of a SSHRC-funded qualitative research project. Developed in the University of Toronto classroom, this initiative brought together Tamil diaspora students and allies to explore how migration influences diabetes risk, grounded in their lived experiences as knowledge holders and expertise and cultural leadership. This cookbook exemplifies how research can move beyond academic publications. These community-rooted outcomes demonstrate the true power of pedagogy to inspire action, foster belonging, and creating lasting impact. As a professor who is of South Asian descent, my primary goal is to inspire South Asian students to be agents of change, foster inclusion, empower their voices that are often marginalized, and to truly promote equity in the classroom and beyond. This encourages our students to build confidence, to cultivate leadership, and challenge systemic barriers. By supporting their advocacy and perspectives, professors can help shape a more just academic environment in a society that values diverse contributions. Thank you, and I will now pass it on to Natasha Kitalagoda.
Thank you, Ananya. I worked on this project as a part of my Master of Public Health with the help of Dr. Banerjee, and I'm so grateful for her support as my professor. To understand why this work is important, next slide, please. To understand why this work is important, it helps to know some of the migration history of South Asian immigrants. The South Asian diaspora is now the largest visible minority group in Canada. It includes communities from India, Pakistan, Bangladesh, Sri Lanka, Nepal, and Western India, each with their own unique histories of colonization, civil conflict, and migration. This community's presence goes back over a century. For example, the first documented South Asians arrived in BC around 1900 to work on farms. By 1907, rising tensions about their presence led to race riots and restrictive policies that forced many to return to India, and those who stayed were not allowed to bring their families. Over the next decades, South Asian communities continued to advocate for their rights. By 1919, and especially after the Second World War in 1947, they successfully pushed back against race-based restrictions. In 1967, Canada shifted its immigration policy to emphasize economic growth and skills, which opened the door for larger waves of migration from South Asian regions. This history has shaped the diverse South Asian communities we see in Canada today, including the large Tamil diaspora. Many Tamil migrants from Sri Lanka came to Canada in large numbers during and after the civil wars in Sri Lanka in the 1980s, 1990s, and 2000s. Today, the Greater Toronto Area is home to one of the largest Sri Lanka Tamil communities outside of South Asia. Next slide, please. South Asian communities in Canada experience significant health disparities compared to the white population. Research shows that South Asians are much more likely to develop chronic conditions like heart disease, diabetes, and other related health problems. While part of this can be related to physical health, a large part is linked to social conditions, things like income, housing, access to healthcare, and the stress of migration and settlement. Within the South Asian migrant subgroups, Tamil migrants from Sri Lanka stand out as having some of the highest rates of type 2 diabetes. One study led by Dr. Banerjee and Shah found that about 1 in 4 Sri Lankan migrants is diagnosed with type 2 diabetes, much higher than the general population and other South Asian subgroups. So there is a clear need to better understand why this is happening and what can be done about it. Next slide, please. Thank you. Although we know that South Asians as a whole are at a higher risk for diabetes, there hasn't been much research looking closely at how people's migration histories, their reasons for leaving, how they settled here, and what they faced when they arrived actually shape that risk. We know that income, education, job opportunities, food security, the neighborhood they live in, and social support all matter and contribute to overall health. When people migrate and have experienced trauma or long periods of instability, these factors can interact in ways that make chronic conditions like diabetes even more likely. Our project really wanted to focus on this missing piece, and now I'll pass it to Nuza to introduce our study.
Thanks, Natasha. And so the contextualizing factors that Natasha just described actually aligned well with our project team, and the Sri Lanka Tamil Migrants and Diabetes study was born. I joined the project team in order to support project activities and conducted all the interviews. I do identify as being a Tamil-speaking migrant from Sri Lanka. And so I was able to provide and be able to conduct the interviews in both English and Tamil. And so our research objective was to explore the experiences of migration and its impact on developing diabetes among Tamil immigrants from Sri Lanka. We used a qualitative grounded theory approach, community-based participatory research, and an intersectional analytic framework. The reason we used grounded theory was because it involves engaging in simultaneous data collection and analysis. And the approach allowed us to make meaning from the data and render the social processes that participants experience in real time. We use community-based participatory research in order to create meaningful opportunities for genuine participation of Tamil migrants from Sri Lanka living in the Greater Toronto Area. And as the study involved data collection of participants' migration experiences, including pre-migration experiences, having our community advisory board guide and validate all study activities and materials was instrumental to ensure that we implemented the study with the cultural and contextual safety that it required. In terms of the setting and participants, this study did take place in the Greater Toronto area with recruitment across 2 community hospitals and several community organizations across the GTA that service the Tamil diaspora population living here in Canada. Participants, in order to be eligible for the study, had to self-identify as first-generation Tamil immigrants from Sri Lanka, who were over the age of 20 with a diagnosis of type 2 diabetes, and individuals could speak English or Tamil. For the data collection of this study and analysis, there were 30 semi-structured interviews that were completed in person and over the phone. The last end part of data collection overlapped with COVID, so many of those interviews were conducted over the phone. I conducted the interviews in depending on participant preference in English or Tamil. In terms of analysis, we did line by line coding and used the constant comparison method in order to ensure we were being iterative as data emerged. In line with our methods, we shared back findings from the project as they emerged, and we took a transformative approach drawing from narrative composite methodology to develop an arts-based knowledge translation video. It uses artistic forms and expressions to understand, represent, and even challenge human experiences of diabetes among Tamil migrants from Sri Lanka. We will now share a video that shows some of our study findings, and I will acknowledge here that one of our community advisory members joined the project team in order to illustrate these beautiful drawings that are going to be depicted on the video. This also provide a trigger warning that this video does contain content related to war, displacement, and difficult migration experiences. It might be emotionally triggering. Please feel free to step away, pause, or take any actions you need to take care of yourself while watching. We can go ahead and play the video.
Ouch.
Amma, what is it? Why are your sugar so high all the time?
Where do I start? How do I make you understand? When I was a child back home, it was beautiful. I remember my Amma making fresh meals and picking vegetables from our garden. We knew so many people in our village, and I had so many friends. Those were the best and happiest times in my life. But all that was lost when the war started. Guns, bombs, violence. I saw so many people get hurt. We had to move around every few months because it wasn't safe. Our entire village lived in a school for days on end, eating only kanji once a day. That was the worst time. Your tata was killed in one of the attacks, you know. When I became pregnant, your appa said it was time to leave. We wanted to escape the violence and make a better life for you. We contacted an agent to help us get out of Sri Lanka. We left our village by boat to get to Colombo, but the boat stopped mid-shore. If the army saw the boats, they would attack, so we had to walk in the water for quite a long distance. We were so scared because we heard so many people got deported, but we had to take our chances. I still remember the day I sat on the plane. I was too numb to even cry. There was no other way but to leave our home and everything that we loved. The journey to Canada was a blur. When we finally arrived, we couldn't afford to live in a place of our own. Thankfully, we knew some people from another village who had come before us, so we stayed with them. It was a small space with so many of us. We all slept in the same room, and that's where I took care of you. At that time, your appa and I always worked opposite shifts. We had to make ends meet here, pay the loans back home, and send money to our relatives who were depending on us. I hate thinking about it. But the priority was a better life for you. When I got pregnant with your sister, that's when we had to make the change and we got an apartment of our own. We had to work so hard and we were so exhausted. I was working at a factory, and that's when I hurt my back one day. I had to stop working. Around that time, Appa passed away. I felt so lost, I didn't know what to do. I was always worried about how I was going to take care of both of you. I am grateful for this country's social welfare system, but the money just isn't enough. So tell me, how or when could I take care of myself, given all the things that we've been through?
Type 2 diabetes disproportionately affects Tamil migrants from Sri Lanka. This population has had a long history of civil and political conflict that uniquely shapes their patterns of migration. In this study, we are exploring experiences of migration and diabetes among Tamil migrants like Amma, using frameworks of intersectionality and grounded theory. We hope that this study brings light to the complex narratives of Tamil migrants living in Canada and how this might affect the development or severity of their chronic disease.
Thank you, everyone, for watching with us. This video is kind of a culmination of different participant stories that we took and created alongside CAB members and the project team to develop a fictional story that portrays multiple participants' experiences. As I mentioned, we drew from composite narrative methodology, in which we're able to take multiple participant experiences and create one story in order to preserve their privacy and confidentiality at the same time. While we were conducting the interviews and towards the end of the study, there were several support and resource recommendations that participants made during the course of the interviews. Most participants shared that they would very much value a cookbook featuring Sri Lankan recipes adapted to support diabetes management. And we validated this alongside some other recommendations with our CAB members and decided to proceed with creating a cookbook. Around the same time, Darshan from TARMS actually reached out to our team expressing his interest in contributing to the SLMDS project. His passion and his interest, along with recommendations from the participants and our CAB members, led to the creation of the Flavours of Tamil Health cookbook. And so I'll hand it over to the TARMS team now.
Thank you, Noza. And as like Noza, Natasha, and Dr. Banerjee have mentioned in the beginning, none of this work happens without the great work that they've already done. And like being able to do this in the community and get this community work done, it gave us a great opportunity to build on their work and develop resources for Tamil people who are high risk for diabetes and who have diabetes. And it gives us a unique opportunity to really focus on something that is essentially like it's a huge part of our culture. Tamil food, like it impacts every aspect of our culture, and I think having resources that are essential for Tamil diabetes patients that they can use after seeing a physician, after seeing a dietitian, after seeing a nurse educator, being able to have these resources in hand. What we're hoping is that this will kind of give them an opportunity to improve their health and improve the impact and be able to make sure that they allow diabetes to fit into their life rather than allowing the diabetes to take over their life. And so if we go on to the next slide, I had this opportunity to work with Dr. Sagatya Sriranjan as really taking a lead on this project, and we've been able to develop the Diabetes Cookbook together. And of course, as I mentioned, that none of this happens without the team at Sahar. And I want to give obviously a particularly big shout out to Inara, who was huge in making this event happen as well. And so really to take the next step in developing these resources, we had to think about what is a need in the community, which a lot of the work was done by Dr. Banerjee, Natasha, and Noza, and really understanding that the higher risk in the population and how can we create resources that are culturally adapted and becoming resources that are really accessible. So we'll go on to the next slide. And so when we're thinking about the need in our community, and we've already mentioned a little bit about a lot of the social determinants of health that have impacted and caused the high risk. There is some like genetic factors, for example, I think a lot of people like to talk about BMI, and then when you look at BMI, we talk about like some of the issues with BMI. Particularly, it's not as accurate for a South Asian population because even in normal BMI, someone can be higher risk for diabetes just because the way our genetically their fat distribution having where sometimes you have higher fat distribution in the stomach, which is a higher risk factor for diabetes. And going back to where we mentioned some of the environmental factors and with the migration and the impact that the migration has had on the Tamil community, we're thinking about their lifestyle factors such as like being part of shift work, getting no sleep, not getting consistent sleep, not being able to have the time and energy to eat healthy or make healthy choices, and no time for real physical activity. These are factors that not just affect diabetes, but also with other diseases as well. But particularly, we have a good understanding that with not being able to get appropriate sleep, eating healthy and physical activity really has a huge impact on developing diabetes and having your diabetes under control. And so we took these these ideas and the research that was done, and we wanted to create resources that culturally was really impactful. And I know we're able to find resources where we see like there's always a translation piece, but that cultural piece where it's relevant, where we can read it and someone in the Tamil community can read it or use it and think, how can this really relates to us? This makes it easier for us to make changes in our life. That's what we're really looking to do. And making it accessible where anyone can, when they're after they see their physician or in physician offices, or even after they see like a dietitian or educator, they're able to access these resources and utilize them. And hopefully, our goal will be that these resources will be used by different healthcare professionals that will be able to take these resources and provide them for their patients as like an extra education piece. And so right now, like we have the Diabetes Canada guideline, which is what we follow here for diabetes care, and like we have the nutritional guidelines, but and these are both you can find translated, but I think a huge missing piece in this is that we don't have enough resources to adapt. Like there's not enough information there for us to use it in a Tamil cultural context. Like if you look just looking at the Canadian nutritional guidelines just at face value, I think a lot of these foods you probably wouldn't see in a Tamil kitchen, and so that's where we wanted to make this change and create these resources. And so the collaboration with Sahar, we're able to create a resource that is present in both Tamil and English, takes culturally relevant foods and our cuisine, and really something that I think is so impactful in our community, and trying to make that in a way that we're able to, someone who has been diagnosed with diabetes can easily follow. Um, any like these recipes and really be able to think about how can I make my transition into diabetes care that much easier. And so I'll pass the next slide on to Sagatya, who I was able to work with on this project.
Thanks, Darshan. So I want to just start off by talking a little bit about the resources that we've developed. We have two sort of resources. The first one is a bit of an overview book that talks a little bit about diabetes and helps you to kind of understand the diagnosis and everything that kind of relates to that. And then the second resource is the cookbook. And so this is, a compilation of various recipes, as well as some tips on how to modify, your diet and the way that you're cooking. Something to kind of keep in mind is, neither of these resources are meant to be used in place of advice that's provided to you by your healthcare provider, but rather resources that you can take with you to that setting and have a more comprehensive conversation with your healthcare providers, and help your family members as well to kind of understand the impact of diabetes on your lifestyle, and more specifically the way that you eat. So this first book, I just want to do a little bit of an overview on which things are highlighted in both of these resources. So in this first overview book, we talk a little bit about, what is diabetes, how to distinguish between type 1 and type 2 diabetes, what sorts of symptoms to look for, as well as risk factors that are involved in the event that, you may not have actually met the criteria for a diagnosis of diabetes just yet, but perhaps there are some risk factors that make you more prone to it. As well as complications and, ones that are very much relevant to us from the South Asian community. And this overview book also includes a little bit of information on dietary and lifestyle recommendations, because that is a huge component in terms of managing diabetes. With the next slide, we'll talk a little bit about the cookbook and what's included in that. So all of the recipes that we've included are recipes that are commonly found in South Asian or in Tamil cooking. We've looked at each of these recipes. They've been reviewed by nutritionists as well as endocrinologists from the Tamil community, as well as providing you with some recommendations so that perhaps if a recipe isn't relevant to you, what ingredient changes you can make so that you can incorporate that into your diet in a much more easier way. We also are providing a little bit of education on things like reading nutrition labels, as well as looking at, portion control and alluding back to the Canada Food Guide and how it can be applied sort of within South Asian cooking. So this next slide just highlights kind of the different platforms that we have started off by launching the resource in. So shortly after this session, you'll be able to go to the SSHRC website underneath the diabetes, the migrant study, and find both of these resources available. You'll also be able to access these resources on the TARMS website. It's just, we're just waiting for a couple of logistical things to be set up. And then there's also flow paper. So just like a flow paper link that you'll be able to access where you can have it on any of your personal devices as well. And so now I'm going to just take this opportunity to share my screen and just switch over so that I navigate through the resource and show you all a little bit about it. Great. Okay. So this first book, which is the overview book, as you can see, you're able to kind of navigate and interact with the document itself. Now, something that we thought that was important was that when we're providing this sort of bilingual translation or for both of these resources, we wanted to make sure that the translation is readily available kind of side by side. And we thought that that was important because when you want to bring in a resource like this with you to your healthcare provider or to your nutritionist, they're able to sort of directly understand that translation and help you understand, what it is that they're hoping to discuss. So it includes various components such as the symptoms you'll be facing, risk factors. There are also a lot of interesting sort of graphics that we've used, talking a little bit about the complications of diabetes. And then, transitioning into where the cookbook kind of comes into play. So how you sort of make those lifestyle changes as well as, changes to the way that you're eating to help manage diabetes. A really important thing that we thought would be helpful for people is sort of understanding, how our culture and our religion also play a role in this. And so within the South Asian community, there are lots of festivals, there's lots of fasting that takes place, and, typical guidelines that are provided in terms of how we should be eating. If we do have a diagnosis of diabetes, they're not really available. And so making sure that if you are engaging in something like this, having that balance of still being able to celebrate your culture, as well as perhaps speaking to your healthcare provider in terms of making sure, you're not having low levels of diabetes, low levels of sugar, how you're going to monitor the carbohydrates that you're eating, all of that stuff would be very relevant here. And so now I'm just going to pivot over and show you all the cookbook. So the cookbook is a bit more of a longer document. As you can see, there are quite a bit of recipes that we've included. And we've also included in the beginning a little bit more information in terms of how we can start to approach nutrition and understanding, how to perhaps count calories or count carbohydrates. So this next page here, which is also included in our diabetes overview document, is a really important one. And I say this because it might be, probably one of the elements of our cookbook that is the most easily accessible and probably easily applicable page as well. So For example, it includes things such as, incorporating or how to look at a low glycemic index when you choose different carbohydrates. That's something that's really important in managing diabetes because, we want to focus on eating fruits or eating carbohydrates that sort of gradually and minimally increase our sugar levels in our body. And so that's something to take into consideration. Another thing that's, I think, very crucial in South Asian cooking is the use of spices. And sometimes we kind of forget the fact that a lot of the spices that we're buying at stores already have salt incorporated in it. And so keeping that in mind when, you're adding additional salt or managing your sodium levels in your diet. So this page kind of provides a little bit, a lot of different tidbits that you can incorporate in your existing day-to-day cooking. We have a sort of, once again, fun kind of way to represent portion control. And then we have the bulk of the cookbook, which is all of the different recipes. So as you can see, once again, there's that side-by-side translation, which is really helpful. And also all of these recipes have been reviewed by the nutritionist. So they've really done their best to kind of make sure, we're minimizing the salt intake. We're using alternative ways to perhaps fry things like using an air fryer and different things like that. So we really, kind of did our best to incorporate relevant recipes and did our best to sort of make sure that this was really an attempt at culturally contextualizing management in diabetes. So I'd just like to go back to our original presentation. So part of the next steps, starts with where we are here today. It's amazing that you are all here to join us today for this launch. But what we're really hoping is for us to use this as our first step towards reaching out to the larger community, reaching out to healthcare providers, being able to, give them these resources so that they can have them in the healthcare setting, as well as reaching out to various Tamil communities, so that you also have access to this information. We're more than happy to set up workshops with your various organizations, both in Tamil or in English, or kind of like a bilingual format, to kind of go over these resources and do our best to provide diabetes education. And lastly, as I mentioned before, our resources are available on the various digital platforms at the moment, but we're more than happy to work with you all to see how we can further expand our network. At this time, there are so many members that were part of creating these resources. So I just wanted to extend my heartfelt thanks to everyone that was involved in this project. And I also wanted to take this time to make further acknowledgements to the contributions from the SLMDS interview participants, the community advisory board members, and our community partners. Truly, we wouldn't have been able to complete this project without your work, and we wouldn't be able to kind of continue to grow this project and bring it to your homes as well without your support. So thank you so much for that. At this time, I'd like to open it up to our participants, as well as our panelists, to have a collaborative session here where you're more than welcome to ask us any questions about either of the projects, any questions about the resources, and just any feedback that you might have. You can either raise your hand and we can take it like that, or if you want to write in your questions in the chat section, then we're able to read from there as well.
I think I can start off with something in the chat. I can just address first. Thank Nasima for mentioning. Yeah, I agree. Like the cultural context, and that's why I think the goal with these resources will be to make sure that we do like increase the awareness of like what diabetes means for people in the Tamil community, and also be able to really provide resources that are culturally relevant, which I hope we're able to showcase. Pugalia, I think you mentioned applicability in the gestational diabetes population. So I think it is, I definitely think the resources are relevant, especially from the food standpoint. I think where in terms of like some of the complications and management piece, we don't have those yet in our resources, and that is something that we're thinking about adding down the line. And I also think that what specifically for the Tamil community, a big piece will be to also address some of the myths and stigma around specific food, especially with not just gestation in general, and also with gestational diabetes. I think that would be really big for us from a resource standpoint.
I did see a hand up from Nadarajan. Do you want to share your question?
I think there are a few comments in the chat about the applicability to other South Asian populations or South Asian foods. Could you guys comment on that?
Yeah, so I think that's a great question. Obviously for us to kind of manage, the scope of the project right now, we tried our best to select recipes that we thought were kind of relevant. But for sure, I mean, this, like I mentioned, like this project really is just a stepping stone. And so the more interest or the more sort of need that we're able to appreciate from the various South Asian communities for expanding the cookbook, or even expanding its implications on various demographics, like earlier mentioned, the in gestational diabetes. We are definitely more than happy to kind of incorporate that, and seeing that that is a bit of an interest, it's really important for us to kind of take that note right now and see how we can grow from that point. So yeah.
Thank you. And another comment about expanding this work to the UK, we'd be happy to hear more about that. So please contact us. In terms of a publication from the interview study, we're currently working on the publication and plan to submit it for publication soon. So we'll definitely, please feel free to reach out to us and we can share that publication with you once ready. How are patient partners engaged in the development of this cookbook? And have you received any feedback from the consumers of this cookbook?
So this is actually one of our goals as a next step that that Darshan and I have kind of worked towards, perhaps developing more of like a QI project based off of this. So we haven't had partners who were or contributors towards the research study engage with the cookbook just yet. But our hope is that once we have the cookbook and the resources out, that we're able to partner with the various healthcare physicians and participants of the study so that they're able to provide us feedback, so that this is a really dynamic resource that kind of takes in feedback and we continue to modify. I guess in terms of the information that we chose to include in the into the cookbook and the resources, this is all sort of from feedback and contributions from the various studies, as well as some of our members who are part of the Tamil Health Association. They were also able to give us some input in terms of what individuals within the Sri Lankan Tamil community or the Tamil community was looking for, so that helped us decide what to actually include in these resources.
Thank you. Another question is, how can families use this cookbook alongside mainstream diabetes guidelines from their doctors?
Yeah, I think so. For well, obviously, we recommend seeing a physician, getting a diet. These resources were developed with the like feedback and input from some great dietitians in the community, and we so it's important to see a dietitian, get their direct recommendations, and what we're hoping is that this will be like what based on what they tell you and based on what the recommendations that you get, we'll be able to be as a reminder, as something that you can look back on and say, okay, I can do this, or I can substitute this in my meal, or I can do this in terms of a recipe. And so that's what our goal is to be like an add-on to the advice and feedback you get from your physicians. And we fought in a lot of the complications and a lot of the in our initial diabetes education resource, the complications and some of the information that we have in there is from the Canadian guidelines. So we're hoping that it kind of adds as a supplement to any of the feedback and information you get from your healthcare professionals that you see.
Thank you. Another question I'm seeing in the Q&A from an anonymous attendee. I'm curious, are there groups that you feel may be over or underrepresented in the study population, even within the Sri Lankan Tamil community? I do feel like we tried to be comprehensive within this resource for the Tamil migrant community from Sri Lanka. Is that correct? But happy to answer more questions regarding that if you want to elaborate. What were some of the challenges you faced while doing this work?
So I can say from our standpoint, like I'll just talk about the like I can't speak on the initial project and development of the project, but I can speak on just developing these resources. And I think for us, knowing how important Tamil food is to the community and the culture, the pressure was on to make sure that this was good and make sure that it was relevant. And being a part of the community, we really want to make sure that these resources were culturally adapted. I think that that was something that's a reason it took us longer than we initially anticipated to develop these resources because we want to make sure it was something that was culturally relevant, but also got feedback from different members of the community. And that's why we had dietitians, other healthcare professionals, and other community members involved in developing these resources. So I think the like hurdle for us is just making sure that it was something that really thought about how can we make sure that they're able to fit diabetes into their life and their lifestyle. And that was like the goal, and that was I think the biggest hurdle for us. So just like making sure it's something that people can like have a path of least resistance to um, creating recipes and making food for their diabetes.
Thank you. And we will share our contact information in the chat shortly. Are there any collaboration opportunities where we can collaborate with the South Asian Health Research Hub? Maybe Ananya or Nara, do you want to comment on that? Oh, I see Ananya's answer in the chat. So feel free to reach out to that email address for Sahar, and Times has also shared their email address. So yes, open to collaboration and discussion about your project.
And if I can also just address one of the questions that was mentioning about the other South Asian communities, and I think what we were hoping and what we hope with these resources is acts as like something that inspires something that's developed in the other South Asian communities as well. Although there was a focus on the Tamil community with our project, I think the project that was done by Dr. Banerjee, Nuza, and Natasha really showed that uh, the South Asian diaspora in general has a higher risk of diabetes, and the resources are needed for all South Asian communities.
I'll also add, Darshan, that our team has had several discussions that while the cookbook was designed specifically for Tamil migrants from Sri Lanka, a lot of the recipes do and are relevant to South Indian populations. So many of the cuisines do overlap. And so there are recipes that you can find in particularly South Indian cuisines that overlap with ones that are covered in the cookbook.
Thanks, Niza. And we'll be sharing the links to the cookbooks after this webinar. And I see your question in the chat. Please feel free to email the email addresses we've included in the chat so we can discuss that further. And yes, it's a free resource. Not seeing any other questions. Are there any other questions from our attendees?
Natasha, I think there's another one in the Q&A.
I just said they
Okay.
should reach out to our emails.
Perfect.
So if there are no other questions at the moment, oh, maybe there is. What's something you're especially proud of? Anything the committee would like to highlight? I feel really proud of this project because of the team that was developed. And I mean, it started as a project. It started as an assignment in my master's in Ananya's class. So I feel very grateful to have been supported by such an incredible researcher and this incredible team. I couldn't have done it without them. And honestly, it's been a long endeavor, but so worth it. And it's amazing to see these types of resources being built as a result of it.
Thanks, Natasha. I'll chime in. I'm echoing Natasha's gratitude to both Ananya and the team. And of course, Natasha, for finding this gap and wanting to really explore it. For me personally, it's been a personal endeavor as well, because as I spoke with participants and learned about their stories, it reflected my own family's migration trajectory and their experiences as well. But I think something that is really important to highlight is that we heard from the participants and we responded. And so for that, I am very proud and happy to have worked on a project that was really responsive to the participants and to our CAB members. I believe earlier there was a question in terms of challenges. There were actually several challenges, as you could imagine, within a research study, but one specific one that I will highlight is even the name of the project itself. We had initially named it Sri Lankan Tamil Diabetes Project, but there was some contention about the use of the word Sri Lankan. And so again, very grateful to our CAB members and our project team for their flexibility, their honesty and transparency, and their willingness to work through the challenges in order to ensure that we're being responsive to the needs of the community. And more than anything, I'm really proud of our participants. They shared very vulnerable experiences. Many of them shared accounts of their own migration and war trauma that they hadn't revisited even in their own minds or in their daily life. And so to really applaud them for their strength to be able to contribute to this project, both their experiences, but also to find meaning and reflexivity in themselves to continue going forward after this project.
I guess like on behalf of TARMS, I mean, this was like an opportunity that Darshan and I have been working on throughout our medical education. And now I guess transitioning into like being physicians, being able to implement something like this. I think what I'm really excited for is helping to motivate other members of TARMS to take on projects like this. bring something like this into our own care and our own practice, and being able to like educate my own colleagues and peers as well, that there are opportunities like this that we can all kind of take on to advocate on behalf of our communities and you know, the demographics that are relevant to our practice. So
Yeah, I just, you know, really went out. I'm actually like, you know, we've been working on this for so long, and, you know, as an academic, you know, often like the very few, you know, racialized women in the classroom teaching about health equity, you know, just reminds me just the power of students. And, you know, Miza and Natasha, you know, they saw themselves in this work when I had presented the data. And I think as researchers, we need to really prioritize communities to lead, and that includes our students in the classroom. They are truly agents of change. Unfortunately, in the South Asian community, there's a lot of parachute helicopter research on us that is not led by South Asian academics and communities. And, you know, we really need to reflect on the fact that, you know, research on diabetes in South Asian communities has been happening for over 20 years. Like there's just plethora of evidence of our risk, which is actually increasing substantially year by year. We're getting diagnosed with diabetes at very younger ages. It's intergenerational, but there's been very little done to actually address and create solutions. And, you know, solutions really lie within the communities. And this is really a prime example of, you know, members of the Tamil diaspora community and allies coming together. Like we intentionally haven't published yet because this is our foremost primary outcome. And this will have the most impact on the community. We are excited for the publication to come because it will really share stories. But if there's any researchers out here, I'm just really emphasizing the importance of community leadership in this work, and outputs that are given, that are led by the communities as opposed to our own personal academic agenda for our own careers and so forth. So just really grateful. I've seen each of these 5 individuals who are all students came to me, wanted to work together, and are now professionals and leading and also mentoring and inspiring the next generation of learners in our community. So thank you to each of you. I feel like a proud mom, sorry.
I'll just quickly add at the end, because I know we're running out of time, but none of this happens without like the right person getting the right project, looking for the right team. And obviously, Dr. Banerjee, you know, you hear from what she just mentioned. She's passionate about this work. She's done a lot of this work, and without her work, this doesn't happen. And, you know, I reached out to her because of my experience of, yeah, there is a lot of research on South Asian diabetes. And I actually reached out to another professor before this, and I was told that there's already a lot of research out there, so there's not much else to add on. But then there is a lot of community work that needs to be done, and Dr. Banerjee has done this work, is continuing to do this great work. So obviously, we need more people like Dr. Banerjee who can do this work for our communities. Yeah, I think that's one of the main takeaways from this.
Thank you everyone for your kind comments in the chat. Our team really appreciates it. With that, I think we can wrap up. So thank you everyone for attending today's webinar. Again, our emails are in the chat, and also we'll send out our contact information as well as links to the cookbook. If you have any questions for us, please feel free to reach out. Also happy to chat about collaboration. Thank you for your time today, and I hope you have a wonderful afternoon.